All right. Walk me through this question here.
Okay. Which of the following is the most likely diagnosis? Migraine, temporal lobe epilepsy, schizophrenia, nasal polyps, or phantosmia? A 27-year-old woman presents to the clinic with a 6-month history of recurrent episodes of perceiving strong, unpleasant odors in the absence of any identifiable source. She reports that these episodes last for a few minutes and are followed by a headache. She denies any history of head trauma or sinus problems. What are the following physical examination and vital signs are within normal limits? What are the following is the most likely diagnosis? I'm going to go ahead and get rid of migraine. Ooh, actually, I'm going to get rid of schizophrenia and nasal polyps for sure. I know that migraine can, no, migraine can present with like different types of auras, specifically like any type of aura that like related to any sense. But I
Sure.
feel like they would have identified that the headache as the main problem instead of the absence of like identifiable source and you see perceiving a smell. I know temporal lobe epilepsy can cause like smells issues. Like I don't, so the thing is that normal vital signs and just a small headache with no trauma or sinus problems. So I'm between phantosmia, which is like I'm assuming like just random smells without identifiable source, or temporal lobe epilepsy.
Okay.
But I'm leaning more towards phantosmia just because epilepsy, I don't know. I don't know.
What's your gut say here?
My gut says temporal lobe epilepsy, but I just don't agree with my gut. But my
Okay,
gut
good.
says that.
So give me okay. So each one, this is how I want you to break it down here. Talk to me. What pieces of evidence go with the each one, if that makes sense, right? So what supports your gut answer choice of temporal lobe epilepsy? What supports your answer choice of phantosmia? And then ask yourself, does it fit the whole picture, right?
So the temporal lobe epilepsy is pretty clear. Like that would be a very like good reason for strong smells like without an identifiable odor, and maybe even the headaches that follow it.
Okay.
Um, the things that go against that is like maybe no head trauma, no anything that like relate like no family history that at least they bring up of like issues with this before. That would go against it. Phantosmia, I just think the main problem is that um
Okay.
this person is having strong unpleasant odors without any identifiable source. So that's really the only thing that I can see going with that. But I don't know about headache. I don't think a headache would really follow that.
Okay. So
So
what are you going to go with here? And then we'll talk about this question.
I'll probably go with temporal lobe epilepsy.
Okay. Okay, good. So this is kind of interesting here, right? And so headache. Um so I so let's talk about which is commonly seen in temporal lobe epilepsy. Temporal lobe epilepsy is a focal epilepsy that originate in the middle or lateral lobes and can present with the various system, which is olfactory hallucinations. Okay. So this one's a little bit tricky in a sense, right? So when I take a
Mhm.
look at this question, right? Phantosmia is good. It's a it is a diagnosis, right? But it doesn't fit everything here. Does that make sense?
Mhm.
So if you
Mhm.
take a look at it, it's like, okay, so you get this smell, but also you get some headache, right? All this stuff, right? And then of course, things like schizophrenia and nasal polyps. It doesn't, schizophrenia, you're gonna have other things, right?
Yes.
Flat affect and sometimes psychosis, things like that, right? And so unlikely schizophrenia, nasal polyps, right? You're gonna have nasal obstruction a lot of times. You can't smell, right? Physical exam are usually not going to be within normal limits, right? You're going to be able to see, oh, the nose has some polyps maybe in it. Okay. So let's take a look at kind of migraines, right? Recurrent episode of moderate to severe headache, unilateral throbbing, accompanying nausea, vomiting, sensitivity to light and sound. Other migraines can have an aura, such as an aura, olfactory hallucinations are not a typical feature. It's very, very rare that you can have smell issues with migraines, right? You can have actually
Mhm.
vertigo with migraine. You can have, light sensitivity, things like that, but unlikely it's smell. So anytime you're dealing with smell issue, you got to be thinking, okay, so is it pinpoint, focal, right? You get headaches maybe after, right? So the best or most likely diagnosis is going to be your temporal lobe epilepsy here. So
Okay. Okay.
good way to work through it. Does it make sense? Kind of
So
you're
I like that,
yeah.
and I've done this before, and you've told me this before, but going through like if I'm 50-50 like I was, and I ended up choosing Phantosmia at first, or Phantosmia, however you pronounce it. But you said like what things go with it, what things don't go with it. That's a good strategy to always employ, right? Like,
Yep.
okay, Is this accounting for everything? Is this not accounting for everything? Okay.
Yeah, exactly, exactly. Because sometimes, phantosmia seems like a good answer, right? It's like, oh, they have issues with smelling something that's not there. But then does that completely fit with everything else? Does it fit with the headache, right? Does it fit
Mhm.
with, things like that, right? You want the whole picture to fit, not just one symptom. So that's gonna, keep you away from trouble if you use that test taking strategy.
Cool.